Hi, my name is Connie, and I will be presenting my slide on prognosis of meningitis. So on this slide, let's focus on bacterial meningitis first. Patients with bacterial meningitis, they have the potential to meet expected outcomes of therapy when there is no delay in administering appropriate antibiotic therapy, along with dextromethasone, quickly after performance of a lumbar puncture or after blood culture is obtained. After performing these diagnostic tests, we need to promptly administer the steroids first and then the antibiotics. And we need to make sure we get the blood culture before administering any antibiotics. So the purpose of administering the steroid, which is dextromethasone first, is to prevent massive injury to the leptomeninges from the inflammation caused by antibiotics when it destroys the bacteria. So many studies have shown that a delay in administering the steroid and antibiotic has adverse effects on mortality and residual neurological defects. So there was a study of 173 patients with community-acquired bacterial meningitis. A delay in antibiotic treatment of more than 6 hours compared to treatment given within 2 hours was associated with an increase in hospital mortality and an unfavorable outcome at discharge. So the importance of administering antibiotic and dextromethasone can help decrease severity of the infection. It also reduces damages to tissues from inflammation and decrease neurological complications associated with meningitis. So these neurological complications are like impaired mental status, increased intracranial pressure, and cerebral edema, seizures, hearing loss, and intellectual impairments. So by decreasing these neurological complications, we see a lower mortality rate in patients with bacterial meningitis. So next, viral meningitis. Patients diagnosed with viral meningitis is usually a good outcome because most cases resolves on its own in about a week or so, which is like 7 to 10 days. So a mild form of viral meningitis without encephalitis is not fatal or associated with higher mortality rate compared to bacterial meningitis. As I mentioned before, with bacterial meningitis, we have neurological complications that can cause brain damage, so we cannot delay the treatment with antibiotics and dextromethasone. In bacterial meningitis, it is more serious, and it can lead to death if not treated early. But for viral meningitis, there is a spontaneous recovery. It's often self-limiting condition. So we see a higher mortality rate in patients who are elderly, immunocompromised, or have comorbidities like diabetes. Just like most diseases, these patients have a weaker immune system. So it is more difficult for their body to fight off infections, and that leads to more complications and a poor outcome. So if patients have herpes simplex viral meningitis, treatment would usually be an antiviral like a cyclovir, and it is crucial not to delay treatment if herpes simplex virus is suspected. But for most viral infections, we just let it run its course and it will go away as our body fights off the infection. So this is all for this slide. Thank you.